So, who am I speaking with now? I can't see you. Who? Okay, I'm still talking to Gode. So let's continue. We've already explained, you've told me about the key household interventions. So what do you really understand by the reason why we think it's important to improve family and community health practices for integrated management of childhood illnesses?
Reduce child morbidity and mortality.
Exactly, that's just it in basic terms. So that's it. Okay, you're right. You have your full mark. For also child health, you have your 10 marks. Who is the next person? Congratulations. Next person. Kindly switch on the video so I can see the person's face. Dorcas. Do you have your complete notes? Okay, let's start with child health. You will also send me your name so I can get the proper spelling. Have your notes for integrated management of neonatal and childhood illnesses. Yeah, you're going to meet him to unlock it. Okay, good.
Okay.
Yeah, let's continue. As you can see, the test is not hard, so don't be scared. It's just for me to test your level of comprehension and how you understand what you have in your notes before the exam commences. So let's continue, Dorcas. See your notes. Raise it up. What topic is that? I want to see the last two topics: integrated community case management interventions and improving health system for integrated management of childhood illnesses. What do you hope to achieve from the integrated management of childhood illnesses?
Morbidity and mortality.
Is it everything that is reduced morbidity and mortality? There are other qualities. Tell me. There are a lot of other things there. That's not the only reason.
To improve the health of the children.
Yes, improve the health of the children. Exactly. To strengthen the health system. And what it involves is improving infrastructure, workforce capacity, and supply chain management for the patients. Last topic, which is the infected patients. And you're also there to ensure community engagement. You can ask the mothers to come together. You can educate them on breastfeeding and a lot of other things. And you also referral system. Okay, when the case you can't treat it, you can refer them to a hospital. What are the common forms of gender-based violence? Common forms of gender-based violence.
We have physical violence.
Yeah.
Sexual violence.
Exactly.
Psychological violence.
Exactly.
Violence.
And economic violence.
Economic violence.
One thing about gender-based violence is the fact that some of the things that happen, people think are not actually violence related. Especially when people just think it's only physical violence that is a form of violence. As explained in the notes, physical violence is the one that is commonly known as domestic violence. Everybody say, he beats me, acid attack, honor killing, and all those kind of things. Then when it comes to sexual violence, is rape, sexual harassment, child marriage. Telling a child that is as young as 8 years old to go and get married to, even if the person is around her age, a child has no business with marriage. Then also involves female genital mutilation. The network is bad. Can you hear me now? Okay, I'm coming. I'll give you cake. I'm busy right now. Can you hear me now?
Yes, ma'am.
So the other form of violence, as we said, is psychological violence, which is the emotional abuse, coercion, threat, and social isolation. Then the last one, which is not the least, is the economic violence, where the person is denied any access to financial resources or employment or discrimination or property inheritance denial. So these are forms of gender-based violence. Can you hear me now? Nigerian network.
Yes, ma'am. I can hear you now.
Okay, good. So Dorcas, you'll have your full mark for the two courses. The next person, we don't have time, please. Hey, team, I'm waiting for you. What's your name? Okay, read the last sentence in your notes. Can you hear me now?
Yes, ma'am.
Okay, read the last sentence in your notes.
Violation of human rights that affect millions of people, especially women and girls.
For that management to succeed, it depends on sustained government support. If there's no government support, that one is not going to work. Adequate funding, they need money. Continuous training of community